Today the topic we are dealing with is the Mullerian anomalies. So to start off with some questions, the first question is, what is the unicornuate uterus? The second question is, what is the bicornuate uterus? So what we want to know is the reasons, the features, the treatment, as well as the complications related to them. So the third question we want to know is, what is the arcuate uterus? So in this video, you'll find the answers to all these questions, and in the end of the video, there are some bonus questions. So first, to start off with the uterine, we are starting with the uterine hypoplasia, hypoplasia, or the uterine agenesis, agenesis. So the reason here is it is underdeveloped. It is underdeveloped, or it is non-developed. It is underdeveloped or non-developed paramesonephric duct. Paramesonephric duct. Other thing to note is that what is the treatment for this? The treatment is, in case of infertility treatment would be the surrogacy. And then moving on, the treatment for, there is also vaginoplasty. So vaginoplasty is done in case of the vaginal hypoplasia. So what are the complications? The complication is that it can lead to the infertility. That is a complication. Next, we are going to look at the unicornuate nucleus, the uterus. So the unicornuate uterus. So looking at, firstly, we are checking the features. So in case of the unicornuate uterus, there is a non-developed paramesonephric duct. Paramesonephric duct. And looking at the treatment is that there is excision of the rudimentary horn, in case there are any excision of the rudimentary horn. Now, what are the complications of this? Complications of the unicornuate uterus is that they can be uterine. There is uterine rupture. Can you see? There is uterine rupture. Then there are abortions. And after abortions, there are also the risk of miscarriages. The risk of miscarriages. And there is also the malpresentation. Then we also have the preterm delivery. There is also the preterm delivery. Then we jump on to the next, that is the uterus didelphs. So this refers to the features is that it has a unfused. There is unfused paramesonephric duct. So there is unfused paramesonephric duct. And what are the treatment for the uterus didelphys? So the treatment includes there is metro, there is metroplasty, and this is the resection, metroplasty resection of the membrane, and the fundal, the fundal recombination. So this can be, that is, it can be hysteroscopic, or it may be open as well. So open, the example being the Strassman, Strassman metroplasty. Now we look at some of the complications. So what are the complications of this? So complications, it can involve the risk of the miscarriage, and then it can also involve the malpresentation as well as the preterm delivery. Preterm delivery. Next, we move on to the bicornuate uterus. So, what is the bicornuate uterus? So, the bicornuate uterus, the function being, it is the lower part. The function of the reason is that it is the lower part is fused. The lower part is fused, whereas the upper part is unfused. So this is the explanation, and then we move on to the complication, the treatment and the complication. So the treatment is that there is metroplasty in selected cases. There is metroplasty. There is metroplasty in the selected cases. And then looking at the complications. So what are the complications? The complication is that it has a risk of miscarriage, and it also has malpresentation. There is malpresentation. There is also preterm delivery. There is preterm delivery. Next, we look at the septate uterus. So what is the septate uterus? Septate uterus. So the features in septate uterus is that it is a septa of fused part. Septa of fused part persist. So this is the explanation. Now we go ahead with the looking at the treatment. So the treatment would be by hysteroscopic septal resection. Then we move ahead with the complications. Complications, it includes, there is infertility. There is also risk of the miscarriage. Then there is malpresentation. There is malpresentation as well as the preterm delivery. Then we move on to the next, that is we look at the arcuate uterus. So the arcuate uterus is it is a small indentation at the upper part. Arcuate uterus is a small indentation. It is a small indentation at the upper part. So what is the next one we are looking at, the next one we are seeing is the DES. DES, that is a diethyl stilbestrone. Stilbestrone. So this is nothing but the DES, and it is drug related. It is drug related. So what are the features of this? So looking at the features, it includes, there is a T shape. There is T-shaped uterus. There is T-shaped uterus, and it is shortened. It is shortened, and there is a narrow. There is a narrow fallopian tube. There is a cervical collars, as well as, that is nothing but the coxcomb cervix. Coxcomb cervix. So what is the complication of this? Complication, it can involve, there is the ectopic pregnancy. There is also the cervical incompetence. Next, there is also the clear cell adenocarcinoma, clear cell adenocarcinoma, and this is of the cervix as well as the vagina. So now we look at the answers to our questions. So let's get back to the answers to our questions. So what are the questions we asked? The first question we asked was, what is the unicornuate uterus? So the unicornuate uterus, it is the feature is that it is the non-developed para mesonephric duct. Non-developed para mesonephric duct. So what is the treatment of this? The treatment is that there is excision. There is excision of the rudimentary horn. If any, there is excision of the rudimentary horn. What is the complication? Complication of this, it includes, there is a uterine rupture, and there is also the abortions. Next, there is a risk of miscarriage, risk of the miscarriage, and there is also the malpresentation, as well as the preterm delivery. Now, looking at our second question. The second question we asked was, what is the bicornuate uterus? So the second question we asked was, what is the bicornuate uterus? So the bicornuate uterus, here it is nothing but the lower part is fused, whereas the upper part is unfused. Whereas the upper part, it is unfused. So the lower part is fused and the upper part is unfused. Then we look at the treatment. Treatment is that the metroplasty in selected cases. So we can do metroplasty in the selected case. So what are the complications? It is similar. That is, there is risk of miscarriage. Then there is also the malpresentation. There is malpresentation, and there is also the preterm delivery. The next question we asked was, what is the arcuate? What is the arcuate uterus. So the feature of arcuate uterus is that there is a small indentation. There is a small indentation of the upper part. Now we will look at some bonus questions, and these answers can be given in the comment section. So we are going to look at the bonus questions. So the first question we would like to ask is, what is the uterine? What is the uterine hypoplasia or the uterine agenesis? The second question we would like to ask is, what is the uterus didelphys? The third question is, what is the septate uterus? So these questions, the answers can be written in the comments.